Hi, my name is Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'm going to talk to you about the potential risks and complications of posterior shoulder stabilisation surgery, arthroscopic posterior stabilisation. What are we talking about? Well, this is an MRI scan of one of my patients. It's a transverse cut. This is the back of the shoulder, this is the front of the shoulder. And you see this little dent here and the little blush in the bone. Well, that's from the shoulder dislocating out the back. What's happened is that humeral head has come out the back, it's torn the labrum at the back of the shoulder, this labrum at the front, labrum at the back, and that's a tear. And it's then hit back against this corner here, this bony corner, denting the bone. And the white there is fluid in the bone or bone bruising, and indicates that the MRI scan has been taken shortly after the injury itself. This here is the arthroscopy of that patient. So this is looking from above down. This is inferior, anterior, posterior, and this is the labral tear at the back of the shoulder. I've already placed one anchor, that blue one there, but not cinched it down. I'll do that a little bit later on. Second anchor is in. The passer with the passing wire is there. What the passing wire is used for is, with this system, is to shuttle the blue suture back through the tissue and then tie that down. These are really clever. They've actually got a little Chinese finger trap within the suture and it locks itself, so we don't need a knot. Knots add complexity and cause problems with the patients occasionally. And that's a complete repair there. Now, what I tell patients is, when we're discussing the potential risks of surgery, is that this is arthroscopic surgery and it's not particularly risky. The risk of infection is 1 in several hundred. The risk of nerve injury is 1 in several thousand. Frozen shoulder is and can happen. It probably happens in maybe 3 to 4% of patients. It will actually help the repair heal up and it will go away, but it can be a bit miserable until it does. Of course, there's an anesthetic, and we all know there's a risk from the anesthetic. Now let's put some science behind this. I'm going to look at 2 papers. These are both systematic reviews and meta-analyses of the literature. First one was 2015, the second one 2021, and they're tabulated here. DeLonghi 2015 looked at 53 publications, 27 dealing with arthroscopic operations and 26 open operations, with a total of 269 patients. Vopat 2021 looked at 39 publications with a large number of anterior and posterior surgeries. And if we look at the complication rate, as I said, is actually quite low. So 1.6% and 2.23% respectively. Of that, recurrent instability happened in just under 10% of patients. So you do need to be aware of that. And as follow-up progresses out, that number may even rise from there. So infection rate was very low, 0.23, 0.37. As I said, 1 in several hundred. Subacromial impingement is rare but can happen, 0.5% and 0.74%. That's where the rotator cuff is hitting the acromion as you lift up and you get a catch at about 90 degrees. Frozen shoulder or adhesive capsulitis, the same thing, reported in the 2015 paper at 0.37%. I think that's probably a little bit low actually. I would normally suggest probably closer to about 3%. I think it depends on what you actually classify as frozen shoulder. A lot of patients get a mild variant, some patients get a severe variant, and I would think they're talking about the severe form of it. Full thickness traumatic rotator cuff repair, pretty rare, and they're quoting 0.37%. And stiffness, that's scar tissue rather than frozen shoulder in that situation, and that's something else to think about. You can get some scar tissue from this, and in a very small number of patients at about 12 months post-op, I will take someone back to theatre and free the scar tissue up and give them their range of motion back. So that is a good summary of potential risks and complications. If you'd like to take this a little bit further and actually look at the publications themselves, if you scan that QR code, it will take you to each of those publications. I hope that gives you a good understanding of the potential risks and complications of a posterior arthroscopic shoulder stabilisation. Thank you for listening.